I just had a pain in my left breast, and that's the only way to describe it. It's really rare. You can't see it on a mammogram and an ultrasound, and I'm sorry, it's in your lymph nodes. And I was just like, what? I can't imagine how anyone could go through that situation without the care that I had. When you say that, that sounds like a long time, but when you have two kids, that's a 26-year-old and a 24-year-old left without their mum.
Kia ora, I'm Helen King, and you're listening to Cancer Conversations, the podcast you never thought you'd need for the diagnosis you never want to hear. For Breast Cancer Awareness Month, I wanted to highlight the reality of a diagnosis and what it's like going through treatment. My guest today has experienced what can only be described as a medical roller coaster. Hannah Cozens had recently finished treatment for breast cancer, and she lived in the same area as my friend. But Hannah and I started chatting, and I realised we actually have quite a lot in common when it comes to breast cancer. Like me and other younger women, Hannah was diagnosed with non-lactating mastitis before getting a diagnosis of breast cancer. A massive thank you to Look Good, Feel Better and Dry July for making this podcast possible. Subscribe on Apple Podcasts, Spotify, or wherever you listen to good podcasts. Hannah, welcome. Thank you so much for joining me.
Thank you for having me on. I'm excited.
Me too, because I love meeting people from other countries, and as you talk, people will realise that you are one of our lovely Australian cousins, because it helps people realise that the cancer experience truly is universal. And I think the interesting thing about you and I is the more we've talked, the more we've realised that we have had very similar experiences, even down to being misdiagnosed with non-lactating mastitis at the start.
Yeah.
And going on that whole journey. So let's start off there and talk about the fact that, like I had been, you'd just started a new job, you're starting this new routine, and then you find something in your breast that needs to be looked at.
I woke up one morning, it was after the Monarch long weekend, and I'd been absolutely fine, and I woke up on the Tuesday morning to head to work, and I just had a pain in my left breast, and that's the only way to describe it. And I even said to my husband, oh, my breast feels really sore, and he poked it, because that will help. And I went off to work, and while I was at work, I just started to feel sick. Like, it just felt like a really bad flu or a fever. I got really didn't even really know what I was doing really at work. I remember feeling like, God, what is going on, sort of thing. And I came home and I took my temperature, and, lo and behold, I had quite a high temperature. So I thought, oh, I've got some sort of flu, or, took Panadol, went to bed, got up the next day, still in a lot more pain. And there was definitely a significant kind of, well, I will say lump, but I guess it was more like a solidness in my breast. It was suggested that I had non-lactating mastitis, and I'm a mum of two small kids, and I have had mastitis with both my children, and I have to say that sounded right. And being told by a doctor that it's really common to have non-lactating mastitis, I just sort of thought, okay. She gave me antibiotics and said that huge lump to me seems like you've got an abscess. You need to have that drained. So I was taking the antibiotics, and I know pretty well, particularly having had mastitis, that as soon as you take them, you recover. And it was 48 hours and I was worse. By this point, I'd been on antibiotics for almost a week, and I went back to my GP, and she said, oh, it's pretty nasty, you're going to have to go to the emergency. Now, since COVID, our little hospital in Ballarat, where I live, which is about an hour and a half out of Melbourne, there's been a huge population growth in Ballarat, and our hospital has struggled, and the emergency is in poor shape. If you're not dying, you're going to be waiting a while. So I was sort of like, oh God, okay. So I took myself off to emergency, and so I was in overnight with only two rounds of IV antibiotics, sent home not feeling any better, sent home on different antibiotics. So anyway, it continued on, and I got sicker and sicker. And so then I was told to go back to emergency. So I stayed in emergency for I think I was there for 12 hours and I didn't get seen. Then I had a an ultrasound and a mammogram, which was, this is a really swollen and painful breast. Everyone just kept going, that's weird. There's lots of inflammation, but I think it's just non-lactational mastitis. Everyone just kept saying that, and this is the part of my story where I am incredibly lucky. I think particularly in this, we're not that small, but we're a rural country town, I guess. Was that my old GP, who I had an incredibly close relationship with? She helped me with both my children when they were born. Now works as an emergency doctor. And so she saw my name and went, I'll take her. She's just a really switched on person who's not likely to fob you off for anything. And she said to me, I don't want to worry you, but to me, this is weird. I feel that if it was non-lactating mastitis, you would have cleared up with antibiotics. So I think that we need to send you to the breast clinic. I ended up at the breast care clinic for my first appointment, the breast clinic. And I was, again, this is another part where I was lucky. I got the best surgeon that we have here in kind of central Victoria, Stuart, or even in Victoria, I think, because he works in Melbourne as well. And he just took one look at me and he said, this isn't right. And he also said, just so you know, non-lactational mastitis isn't common in women who aren't breastfeeding, and it's actually a popular misconception. And the reason that men and women get it is usually if they're smokers, because it changes the part of your breast that can cause mastitis. He actually felt that I potentially had a really aggressive cancer, which was inflammatory breast cancer, because my whole skin, there was a huge inflammation in the breast, and I had, red puckering across the breast. So that was pretty devastating. As I said, I'm mum of 2 young kids. I was pretty horrified. And that's where I met my breast care nurse, my McGrath nurse. I'm not sure if New Zealand has the McGrath nurses, but they are incredible. He wanted a biopsy straight away. And it was a Thursday when he saw it, and the closest they could get me in was a Monday. So over the weekend, it got worse. And I developed this horrible, horrendous, very inflamed sort of point to the sore that you could clearly see there was pus underneath it. And then by the time I got to my biopsy, that had burst, and I had this bigger than a 50-cent piece. I'm sort of talking 2 50-cent piece size of a sore on my breast that was just weeping. And I consider myself to be pretty good with pain, and this is probably the most painful thing I've ever experienced in my life. And worst of all, your clothing would stick to it, and it was awful. So I was in hospital for a week after that, on IV antibiotics, not really improving, but not really getting worse. They were waiting for those biopsy results. So the biopsy results came back, and they were very pleased to tell me that I only had DCIS, which I was told was not real breast cancer. I've sort of since learned that DCIS is quite similar to non-invasive prostate cancer. It's not invasive breast cancer, but it's still a form of cancer. And so we were told to kind of celebrate, and it was great. And I was like, fantastic. So I just have to get over this horrendous wound. We don't know what it is, but cool. So I sort of was leaving hospital feeling pretty buoyant and like, thank God. But then on doing research about DCIS and learning about it, it's, women get treated the same way. So it's a really awful thing to say to someone, it's not real cancer, because lots of women end up with mastectomies, lump removals, on treatments for it, because, once it's invasive cancer. So I was pretty shocked to learn that, yes, my treatment options weren't urgent, but they were still required. So then I went home, and straight away off the IV antibiotics, I went downhill again, really, really sick. I went into my GP and I just burst into tears, tried to pull down the makeshift bandage and say, I'm so sick. And she just was like, right, I'm ringing the hospital. So she rings the hospital. She said, I've got Hannah here. She's really sick. And they said, oh, yes, since she left, we discovered she had this other thing. It's a really rare breast disease called granulomatous mastitis. So granulomatous mastitis, everyone was rejoicing. Oh, thank God we found out what's wrong with her. And I also rejoiced. But then I went home and again, I researched it. And granulomatous mastitis is a really rare breast disease that is little is known about it because it's quite rare. They don't really know how to treat it. And more often than not, it's treated with a mastectomy because it's a reoccurring, horrendous breast disease where your breast basically you have these fistulas of pus that go deep into your breast and they just keep creating these sores and these sores keep coming and then they heal and then another one comes and they're incredibly painful. You get fevers, you get everything that I had. So then I went back to my GP on the Monday and I was like, do you know anything about this disease? And she said, I don't. And I explained it to her, showed this information that I'd got. And she said, wow, I'm ringing Stuart, the breast surgeon. And he said, coupled with DCIS and granulomatous mastitis, she's going to need a mastectomy. There's just nothing that we can do. Like, she will have to have a mastectomy. So that was shocking, but I also kind of knew from my own research this is where I was heading.
Wow, so this is over a 2-month period that you're going back and forth, no one's really giving you information. And I was curious as you were talking about being diagnosed with DCIS, did they give you any information or have you then left those appointments and you've had to do your own research?
I did my own research. So
Yeah.
the doctor that diagnosed, that told me the results was just the duty breast surgeon, probably the registrar who was doing the rounds of the hospital. And, because I was in hospital, he came and said, you have DCIS. No one gave me any information. I went back and researched. I went to the breast cancer, Australian breast cancer website and I researched it and then I started speaking to people who had been had DCIS and most of them had some sort of invasive surgery or radiation or they'd been treated the same way as if they'd had an invasive breast cancer. And a few of them were older women that I spoke to who'd had DCIS, had treatment, like had, surgery or radiation, I think one of them was. And then she's now in her 60s and she's got really like invasive breast cancer. So while it doesn't always turn into invasive breast cancer, and that's what they like to stress to you, the conversations that I were having with people who've had it was that it did turn into invasive breast cancer, or they got treated like they had invasive breast cancer. So had the mastectomy, was healing really well from it, feeling great, and we were going on a family holiday to get over, the crap that we'd been through for the last 2 months, and I had an appointment to have a look at the wounds and to ask any questions and whatever, and I thought that it would be just like, well done, you're doing really well, awesome, you'll be back swimming or whatever. And so the doctor came in and it wasn't my breast surgeon because he was actually at a breast clinic, a breast conference. So, and my McGrath nurse was with him. So it was a whole bunch of people I didn't know. They sidled up to me and put their hand on my leg and said, has anyone spoke to you about the results of your mastectomy? And I was like, no, but when can I go swimming? And he said to me, I'm really sorry, but you have a rare and aggressive invasive breast cancer. And I said, I had DCIS. Is it invasive DCIS? And he said, no. This is an invasive lobular breast cancer. And it's really rare. You can't see it on a mammogram and an ultrasound. And I'm sorry, it's in your lymph nodes. And I was just like, what? And then I'm like, but I had granulomatous mastitis and DCIS. And he said, and you have. an invasive breast cancer. And then I just burst into tears. And then my kids were like, why is Mummy crying? And,
Oh God. Yeah.
and then he said, because it's in your lymph nodes, we need to do some more tests. We're going to probably have to, if it's to see if it's anywhere else. And I was just like, I was still kind of like, but I don't have cancer, like, and that was one of the things, because of the way people had spoken to me about DCIS, I was very cautious of saying I had cancer. I would say, oh no, I don't have cancer. No, it's okay. I don't want to take away from people who have real cancer. I just have kind of thing. So I was then like, what? How did I end up in the real cancer basket? I've been trying really careful to be really, you know, not not step into a space that's obviously really difficult for people to be in. It's hard to explain. Like, I didn't want to seem like I was trying to get attention when I didn't need it, because I didn't have real cancer, kind of thing, which I now realize is completely stupid. Yeah, so then I was completely shocked, and so the whole universe kind of came crashing down, because I started to realize that, oh, maybe like I am going to die. Like, I've got two small kids, I've got a 6-year-old now and a 4-year-old, and like I'm in early 40s, and
Yeah.
no one in my family has breast cancer. No one in my family has cancer. Like, my mum got skin cancer, but she's a woman who used to sit in the sun with oil on her in the 60s. So I was sort of like, no, this doesn't. Where did this? Why? Kind of thing. Anyway, so we went on our family holiday. It was a bunch of fun. I spent the whole time crying and then having like some kind of weird stomach pain that turns out it was probably like anxiety and stress that caused my stomach. So yeah, it was a fun time. The kids had a great time.
Yeah.
And then I came home and I had a bone scan and a CT scan. And I go to that appointment, and the doctor says to me, again, my surgeon was still away at this time, so it was just this registrar doctor, and he goes to me, do you know why you're here? And I said to him, that sounds ominous. Like, and then he didn't laugh, so I knew it was ominous. And he said, look, we found a lesion on your spine and on your rib, and we need you to have a PET scan because it's looking like you have secondary breast cancer. And I was just like, really? Like, this is insane, especially because the initial lobular breast cancer, it wasn't a very big lump. It was a long line of cells that were very thin, which is why you can't see it. That was, again, pretty sobering, because I went from being told that the chance of living a long life if I went through my treatment was high, to you've probably got 20 years. And when you say that sounds like a long time, but when you have two kids, that's a 26-year-old and a 24-year-old left without their mum. I remember I've got 3 really beautiful girlfriends, my best friends from when I was 13, who have been the most amazing people for me over this period of time. They actually both left their jobs and drove to where I live. They live in Melbourne and Geelong, so not far, but a distance. And then my other good friend who lives here, we're in the park with my kids and my friend who lives here, her children, and they went across to the supermarket near the park and bought a bottle of wine and chips and lollies for the kids, and we all sat there just talking about how unfair that is,
Yeah.
that you try and be a good person, and just how it derailed. So it was even though it was a really sad time, it's actually a really special time in my mind, of the 3 women who support me a lot in my life anyway. So I had the PET scan and went back and was lucky to be told that nothing lit up on the PET scan. So looking like I don't have secondary breast cancer. That was really awesome. But then it was then learning what the diagnosis, like what the treatment looked like. So another surgery to remove all my lymph nodes, 4 rounds of what they call the Red Devil AC.
Oh yeah, I know this well.
Because yes, because I was young, dense dosing, which means every two
I heard
weeks.
that
So
too. Yeah.
no, yes, yes. um, and so
Yeah.
normally it's given every 3 weeks because your body can't handle it. But we are the lucky ones
I
that we're
know.
given every 2 weeks.
And I think I
And then,
told you in the first time that I spoke with you that it was initially set up as every 3 weeks. And then after that first round, my oncologist calls me and says, "How are you?" And because I minimise everything, I was like, "Oh, I'm okay. I had a bit of a headache yesterday." And he was like,
yeah, yeah,
"Great. I
yes,
want you to think about doing this every 2 weeks."
yeah. I want
And
you to
I
think about
thought,
having fun every 2 weeks.
yeah, yeah. And I wish I had told him that I felt like I had the worst hangover I'd ever had in my life, but I didn't. Um, but I think what you've described, a lot of people are going to relate to that roller coaster of diagnosis, just being in and out of the system, especially an overburdened health system where everyone is so sort of stretched that you kind of get lost and forgotten. And I think your story is such a good example of why you have to push and advocate for yourself when you're being told, yeah, I think it's just this thing. When you know in yourself and you know in your body that there is something going on that needs to be addressed and looked at quickly.
Absolutely. And I think for me, they say don't Dr. Google, but Google's a lot better these days. And I I think that you've got to be careful what you're reading, and I definitely, you look for the correct sources, I guess is what I'm trying to say. But for me, I know that antibiotics work after a certain
Yes,
amount of time. I've been
absolutely.
sick enough and had them frequently enough to know that. So, and also just in my gut, just
Yeah,
knew it wasn't right. It just wasn't right. But so in the kind of long and short of it, I've just finished 12 months of, I guess, it is 12 months exactly since the mastectomy on the 28th of August. So
wow.
I've been through, another surgery, 4 weeks of the 8 weeks of the AC, so every 4 rounds, I guess they say, and then 12 rounds of paclitaxel, which was every week for 12 weeks.
Yes.
um, and then then a month off, and then 3 weeks of radiation every day. And I think when I spoke to you first, I don't know if I'd been through that yet or I was going through it, but I managed it quite well until the end. And then when it had stopped, my skin just
Oh,
peeled
it
off.
goes
It
nuts.
was just,
Yeah. And
yeah, it was
did you
awful.
find as well that there is so much focus on chemo because I don't
Yes,
know, chemo is kind of scary in a way because
yes,
because the depictions of it on TV and stuff make it look horrific. And it isn't great, but they give you lots of medication. And so I didn't
yeah,
really think about what radiation was going to be like. And so I wasn't prepared for the fatigue afterwards. And yeah,
yes.
and how awful it is on your skin. Like it is really challenging to manage that burn and things. What was that fatigue like for you? Did you have that similar experience where it was like afterwards?
Yeah, yes. It hit me like a ton of bricks. So
Yeah,
during the 3 weeks, I was sort of like powering through. I was like there every day, didn't have any skin problems. They were like, "You're
yeah,
doing so great." And I was like, "I know, look at me go." And, finished up. I got really sick of going in every day, but finished up pretty well. But then it was as soon as it stopped, fatigue became really bad. And then the peeling, just the peeling of the skin, and so by the second week after it had finished, I actually had to take the week off work. I couldn't wear any clothes, and the fatigue, and I was also feeling sick.
yeah,
um, and I assume that's probably because my body was really burnt and
yeah.
I was really tired. So yeah, no, radiation was not pleasant at all.
Did you have to travel far for your treatment? Like it was treatment a long way away from your home?
No, I that is where I am incredibly lucky. we have a really big, so like I said, I think we're about an hour and a half, or not even that, from Melbourne. And a lot of people, there are people who, I've had friends who've had other types of cancers that have had to go to Melbourne to the Peter Mac,
Yes.
which is a specialist centre.
Yeah.
It's 20 minutes, so it's not that far. But I did speak to a lot of people while I was waiting, and there were lots of people who were travelling great distances because, so the hospital, that Ballarat Hospital actually covers a huge region, like almost to the border of
Wow.
Victoria. So it's actually called Grampians Health. So it covers all the
Yeah.
way up to like Horsham, and so there are people travelling hours to go there. And I was pleased to hear that the hospital actually has this really nice sort of accommodation for people who are travelling um, hours upon hours and have daily treatments of radiation. And I also spoke to a woman who was actually having radiation and chemo at the same time, so that she could stay there but can you imagine that? I mean, seriously,
Oh,
it's
Jesus.
not my it's not my cup of tea. Um,
No.
but so there were definitely people who are traveling great distances, and if you're coming for just an appointment, you're not given accommodation. So I was sitting there waiting for an appointment the other day and heard somebody say, "Sorry, I'm 5 minutes late. We had to come 4 hours, and then I couldn't find a park." And I was like, "I couldn't find a park either, but at least I only travelled 20 minutes." So
Yeah.
yeah, it's a hospital that it services a massive area, and the actual cancer part of it is new to the hospital, and it's been really well appointed. Like, we are very lucky, but I'm also lucky that I live close to it.
There are a couple of things I'd love to touch on because I think, because I don't have kids, and so I didn't have the continuing to parent experience that a lot of people do have while they're going through cancer treatment. But I cannot imagine still being a mum and a wife while going through the type of treatment that we had.
Mm.
And obviously, and continuing to work and things. And so I would really love you to give a bit of insight to your experience of continuing to parent and navigating a marriage and a relationship while going through cancer treatment.
Yeah, it was really hard.
Yeah.
um, I had a friend who came and helped me a bit, and she'd gone through breast cancer a bit through the pandemic, actually. And she would come and sort of bring me dinner and help with a few things. And I remember on the first day I got home from the day after my first AC round, I was on the couch and she came over to just do a few things for us. And my son was actually home because I can't remember if he was sick or there was some reason. And he was just, he was 3 then, and he was just doing whatever a 3-year-old does. He was very, just mucking around. And she does have children too, but they're teenagers. And she just looked at me and said, "This is so much harder for you because you can't not engage with a 3-year-old and a 6-year-old. Teenagers, they understand that you're sick and that you're sleeping and that you're this and you're that. And yes, it's stressful and hard for them. And there's definitely different. I definitely think there would be different complications with children of that age. But when they're little, it was hard. I have a lot of guilt. I hope that it hasn't affected our relationship, but I wonder if it will have, in a way, when they grow up, that mum was always tired or in bed, because I do often go to bed before them. I'm great in the mornings, but by the evenings I'm just like,
Yeah.
I'm done. I mean, lots of parents are. They we were always really honest with them. I think that you need to explain stuff to children in an honest way. I don't think you can hide stuff. Kids feel it. They know when something's off. They know when you're off. So Darren and I always explained, Mummy's got this, she's going through this, she's not feeling very well, she might go and have a sleep, but um, I think that I had I learnt about a lot of great supports, in that there's lots of organisations out there that um, help parents through that, and make the kids feel special. I think that my daughter, I actually think my daughter really enjoyed it to a certain extent. She was getting picked up by her principal and taken to school, and you know parents were dropping her home and they'd buy her an ice cream on the way. So I think my daughter actually sort of thrived a little bit off the attention. Um, but I still think that and there are positives. Like, not everything about cancer is negative, absolutely. And there are some actually really beautiful things that have come out of me being sick, in that my daughter was always very clingy to me, and less inclined to want to spend time with her dad. And since I've been sick, her and her dad have, because my husband's a New Zealander, so they now watch rugby together. So Luella loves rugby, and
Yeah.
um, and they have a thing where they stay. Dad lets Luella stay up late and watch rugby with him, and they have this really cute kind of thing going on there. So there's been positives, but it's hard. It's hard. I've snapped at them more than I would. I really tried very hard to be a not grumpy, calm parent, and cancer has taught me that it's okay to be. It's okay to not be okay, and it's okay for the kids to see you not be okay. And actually, the most important thing, after you're not okay with them for a reason that is not necessarily their fault, to say sorry.
Oh,
So,
absolutely.
um,
And I imagine as well, because I watch my sisters who have children or friends that have had kids, and I feel like there is so much pressure on mums and mums to be a certain way. And I
I think
think
so.
about, yeah, and I think about, you know, finishing treatment and you're trying to navigate being back in the real world. And I think we've spoken about this before, where I feel like as your hair comes back and you kind of look less sickly, people just go, oh, it's over. So
Yes.
you're back to normal now. And I know for myself that wasn't true at all. And I know you've mentioned as well, it's not true for you. Like, things are not the same. What has it been
No.
like for you to navigate this post-treatment time?
Yeah. So I'm really in the thick of that at the moment, and I'm really struggling at the moment, because yeah, you're not sick as you were, but my God, you were so sick. Like, people, like, it's so funny to think, yes, of course I'm not as sick as I was, but I was really sick. Like, couldn't get out of bed, or I lost all my hair. Like, my body was dying, kind of thing. But I was, yeah, like, I was getting just enough not to kill me, but enough to make me pretty sick. So, yeah, it's really tricky. I've returned to work as well, and I'm still on reduced hours, which is good. But there's still this kind of expectation that you can just do everything. And
Yeah.
I think even in a certain aspect, my husband sort of sees it that way as well. Look, you're feeling better. Like, you had 12 months of being sick. Come on, like, get back into the family, kind of thing. So it's really challenging, and people don't, yeah, they don't give you the same kind of understanding as they used to give you. They've given you 12 months of understanding, and now it's time to pick yourself up and get moving. And that's really hard, because there are days where I can pick myself up and get moving, and then there are days where I can't. There are days where unexplainably I suddenly feel sick, and then the next day I feel fine, and I think that that's just part of your body trying to
Yeah.
heal itself. There are days where I feel absolutely exhausted, and there's days where I have so much energy I remember what it felt like to be a person. um, One of the things I think I'm struggling with the most as well, post all of this, is actually hating my body. And my
Yes.
mum said to me the other day, but look how strong your body is. Look what it got through. And I'm sort of like, yeah, but look what I've been left with. Like, I put on 20 kilos because of this. They give you a bloody, what's that drug called?
Oh,
Death,
Dex.
and it makes, yeah, Dex,
Yes.
makes you so hungry that you eat. I put on 20 kilos during cancer. And I think also probably because of the drugs that I'm on, because
Yeah.
they've put me into a menopause.
Yeah.
Um, and I have one breast, and I can't get two breasts because I'm too overweight. So I have to wear either a fake breast or no breast. And quite frankly, I'd probably prefer to wear no breast, because the fake breasts are uncomfortable. The bras that they put them in are uncomfortable. But I'm too big breasted on the right side for that to sort of be a comfortable experience. So I think, yeah, there's so much that you're navigating after sickness that nobody sees. and everyone sort of expects you to kind of be like happy or grateful or all of that. And I think that there's an element of being that you are. Like a person came up to me the other day and said, "How are you feeling? You look well." And I said, I am feeling well. Like I am feeling well. But there's a trauma as well that's happened. And
Yep.
the other day, because I'm about to start a new drug, and that it's a new drug for early breast cancer people. And I was being educated about it by one of the nurses, and then the nurse got me to fill out, how I'm feeling, what pain I've got, blah blah blah. And one of the questions was, how distressed have you been in the last week? And I can't say I've been that distressed, but I realized that, and I think I circled one, and she's like, "Oh, can you explain to me what that is?" And I said, "Well, can't say that I felt distressed, but I have a new puppy, and I love this puppy because he is healing me. He's getting me out walking, and he's just been the best thing. He's a beautiful Kelpie, and I've got a beautiful old Kelpie, and the old Kelpie came at a point where I was in my early 20s, and I was a bit lost." And he helped me find the life I have now, and I feel like this Kelpie really feels healing for me.
And I so understand so much of what you've said. And if there are people listening, that I'm sure there will be, that will be nodding their heads of all of that stuff, where my body is completely different, and I put on about 15 or 20 kilos as well. And then I felt like there was so much, I know that there was this pressure of, you've got to start exercising, you've got to do this, it will help with your fatigue. And I
It'll
found,
help with the cancer. Cancer doesn't.
yeah,
Chemo works better with exercise, and
and
yeah,
all
like
of that
and
stuff. But I was so broken after I had finished treatment. And it was that same stuff that I felt like really wasn't being acknowledged, that I'd been through a hugely traumatic experience. The person I was before cancer no longer existed. The future that I had imagined was no longer going to be happening. And yeah, my body felt different, everything hurt. I'm the same. I have one breast. If I'd been given the choice, I probably would have gone flat. But there's all
me
of this
too.
stuff. Yeah, but there's all of this stuff that no one talks about, and people in your life don't really realise that, yeah, absolutely, I've just finished this treatment and now the real hard work starts, because I have to, you know, almost like rebuild myself into
Yes,
something, but I'm not sure what that person is going to be. And so I totally understand
that's
about the puppy, because I got a puppy as well about a year and a half after treatment. So I
yeah.
understand this. And so I just really want to reassure you and anyone who's listening that what you're feeling is so normal for where you are post-cancer. Because I mean, even the experience you had of, oh, you have this thing. No, you don't. Now you have this thing. Oh, no, you don't. I mean, even that part of your experience must have been hugely traumatizing.
Yeah, like this is definitely for me been
Yeah.
the hardest, and I had such amazing support. I cannot. I am so lucky. I have the most beautiful friends. I have the most beautiful husband. And I read a thing the other day on an Instagram post that I follow that was saying that in America, they actually, when a woman is diagnosed with cancer, they talk to them, because something like 70% of men leave their wives during an illness.
Yeah.
And I was shocked, because honestly, Darren, he has been amazing, and he has worked hard because I wasn't working, so he needed to bring in an income. He has then come home and found me, sick or whatever, and put the kids to bed. He has shown me love, care, compassion. He has been extraordinary. And so I am lucky. I can't imagine how anyone could go through that situation without the care that I had. My like I said, my best friends, they would come up the week of my AC, and they would look after my children for the week. I could just sleep. So for people who don't have that support, I honestly don't know how they could do it. But
No.
it still doesn't mean that it's not an incredibly traumatizing experience. And on top of the things that we've spoken about, they put you in menopause. And,
I know.
I'm a 42-year-old going through menopause, and
Mm.
but I can't do anything about it either because my cancer likes hormones. So I can't do hormone therapy. I can't do any of the things that you can do to help yourself through menopause. I just have to kind of suffer.
I know. And that's a huge conversation as well. And yeah, I just hope that anyone listening who is in that same spot just realizes that what you're feeling is so normal, and that it does end, like it does get better, like it starts to lift and life starts to feel a little bit brighter. So, Hannah, it's such a joy to meet you, and I'm so glad that you reached out and said that you'd been listening, and
Yeah.
also that when I was in the area visiting my school friend, and I love that we have that
Yes.
sort of connection. So, thank you
Yes.
so much for being a guest and sharing your story.
Yeah, thank you very much for having me, because I followed you, randomly found you, and found you to be, then listened to your podcast and found your podcasts and your posts to be, incredibly helpful. And that is something that I hope that I can help other people with themselves as well.
Thanks for joining me. If you want to find out more about what's on offer from Look Good Feel Better, head over to www.lgfb.co.nz and join me next week for another cancer conversation.